Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, August 12th, 2024. Today and next week, I'm joined by Dr. Ariana Huselid for a unique and very important podcast in two parts. Ariana is going to tell the story of her decision to terminate a pregnancy for medical reasons, sometimes referred to as the acronym TFMR, due to a lethal anomaly in her fetus. For those of you who are longtime listeners of this podcast, you know that we try to be very deliberate and mindful when discussing abortion, mostly because we want everyone to feel welcome here. You don't need me or this podcast to tell you that people have very strong feelings about abortion. Because of this, I don't want to put out content that will make people on either side of the issue feel like this isn't a podcast that they can enjoy and trust. So we do discuss abortion, but I try to be very careful exactly how we do that. Yet, abortion is a reality, and part of that conversation is understanding the various reasons why someone might choose to, or need to, terminate a pregnancy. Understanding these stories helps all of us have more productive and civil conversations about this very complicated topic. So, I am very grateful that Ariana volunteered to tell her difficult story. It is a painful one and a powerful one, and I'm sure you will all learn a lot from her. I know I did. Few reminders: The Unexpected, which is the book I wrote with Emily Oster, is available wherever you buy books. Also, if you have questions for our mailbag podcast, please do email them to hw@healthfulwoman.com or go to our website and click on the link that says send us your questions. These are for mailbag questions, not for personal medical advice. For those, please ask your own doctor. All right, thanks for listening. Enjoy part one of the podcast today, and we'll see you all next week for part two. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Ariana, thank you so much for volunteering to come on the podcast. I really appreciate it. How are you doing today?
I'm doing well. Very happy to be here.
Terrific. So we're going to be talking today about your recent story, which is very important and difficult. And I'm just curious off the bat, what was it that made you reach out to tell your story?
Yeah, as I'm sure your listeners already know, and as we'll be talking about over the course of this podcast, earlier this year, I underwent a termination for medical reasons of a very wanted pregnancy. And it was such an eye-opening experience for me. You know, I am someone who's in the medical field. This was not something that I knew was unexpected, but going through it myself, especially going through it knowing that I'm in such a place of privilege, it was just still so hard. And, you know, since this happened, I've gotten to know so many other women, and just recognizing how much silence and stigma and misunderstanding there is around this topic made me realize that I want to share my story because I think it's important for others to understand that this very sadly is a thing and is not as uncommon as people may realize, and what folks can do who may have loved ones who are going through similar situations in order to support them. And especially in this current political environment, I think it's more important than ever to be talking about some of these things that so often are just brushed under the rug, and yet they're unfortunately a reality for a lot of people who are going through the process of trying to start a family.
Yeah, I mean, I really appreciate that. And, you know, termination, abortion is such a tough topic for so many reasons. And sort of the overshadowing all of it, as everyone knows, is it's so politically and emotionally charged for people, understandably. And it makes it difficult to even have conversations about it. And, you know, in this podcast, it's, you know, we're about women's health and pregnancy, and it's a part of it. And on the one hand, like, we don't want to be a podcast where 50% of the population feels unwelcome, right? In either direction. We want everyone to feel, you know, welcome here and comfortable here, and that they can gain something here. And so it's always challenging to figure out, like, how do we talk about this topic in a way that's helpful to people and not in a way that's going to sort of like validate half the population and piss off the other half of the population? And it's tough, and it's tough. But I think, you know, what you're bringing up and we're going to talk about is that however people feel about this is a reality. And this is a situation that people don't always envision when they talk about abortion and termination. It's just not something that's, that comes across their wavelength, so to speak.
Absolutely. And even, going through pregnancy, for those people who are listening who are like me, which I'm guessing most of your listeners are, who want all the information and love learning about this stuff, it was so interesting going through this process and just recognizing any book about pregnancy you pick up, any podcast you might listen to about pregnancy. There's so much information about, prenatal genetic testing and the importance of getting ultrasounds and all these things. Yet then it feels like there's just this void about, well, what if you get this bad news? And it's not talked about, like this horrible decision that one might be faced with. And most people don't think about what it would be like, or even if they do, it's so different to actually be in that situation and trying to navigate this. And I think there's so much guilt and shame for women and families who get negative diagnoses, and really in either direction and what they choose to do. It's just a horrible situation to be in. And from over the last number of months, I've gotten to know so many women in this community. And, what I want to share, even for those people who really don't think that there's ever a time for abortion to be okay, is these decisions are not made lightly. They are made out of love. These are unbelievably challenging parenting decisions is really what it is, which is so hard to do before you've ever even met your child. And they're not taken lightly, and they're with a lot of anguish, and people are trying to, quote, choose, if you can even consider it a choice, what to do when you have no good option in front of you. In my case, I knew my baby was going to die. The question is when and what was going to be the least harmful to him. And that's a horrible position to be in. And to have guilt on top of that and feel like I can't talk about it is like, it's bizarre. And it makes sense because it's such a hot button issue, of course, but
Yeah. And like you said, the shame goes and the guilt in both directions. People either, again, some of this is internal, obviously, and some of it is external.
Yes.
Some of it's just people intrinsically feel shame and guilt, which is unfortunate, but that's just human nature. And others, it's directly placed on them or indirectly placed on them. And it's the shame or guilt of ending a pregnancy, or the shame or guilt of continuing a pregnancy with the baby that has abnormalities and problems and serious problems. And so it's just like you said, there are no good options, and people don't always recognize that. And which is why, again, I really appreciate that you're going to talk about this with us. And so our listeners can really benefit from what you went through, to put any possible positive spin on a horrible experience, that others can learn from what you had to go through yourself. And I really appreciate that.
Yeah, absolutely. Well, thank you for giving me the time and space to do so.
So take us back to, I guess, right before you got pregnant. So I guess this would be last year. So just give our listeners a sense, who you are, where you're from, what are you doing, like where are you, family life, what's going on in your life at that time?
I was in a space, it was last year at this time when my now husband and I were starting to try to start a family. It was a really exciting time. For a little bit of background, I was someone who did not realize until I was 33 and 7 months and maybe a couple days when I woke up one morning and suddenly realized, oh my goodness, I think I actually do want children. It was bizarre. It was like a light switch had flipped. And up until that point, I really didn't think that I had want to have kids, or at least was very much on the fence about it. So that led to a lot of scrambling to, first of all, get out of a marriage that I was in, to someone who definitely did not want kids at that time. And we realized this was not something that we could compromise on. We couldn't really have half a baby. And, so that marriage ended and I moved home to North Carolina. I had been living in California at that time and was around my family, and was really, really fortunate to meet an amazing man very shortly, I should say, after moving to North Carolina, and who is now my husband. Going into that though, I knew that I was older, and I had also, after moving to North Carolina, gone through a couple of rounds of egg freezing, knowing that I was older, and in that process realized that I had diminished ovarian reserve. So even though I had some eggs on ice, I knew it wasn't a ton, and we wanted more than one kid. So the time pressure was on. So it was an exciting time to start having kids, and yet it was also very anxiety provoking. And we kind of assumed that we were going to have a hard time getting pregnant. And in retrospect, we really didn't. It felt like it took a while, but by early October of last year, 2023, we had a positive pregnancy test and we're just over the moon. Early pregnancy was just such a joyful time. Both of our dreams to become parents was coming true. We were also at that time planning our December wedding, which was really all of a sudden becoming not just a celebration of the two of us coming together, but also our growing family. And early scans, our NIPT were all completely normal. We were on vacation in Bali when we found out that we were having a boy. I mean, it was just an amazing, amazing time. That being said, as I mentioned earlier, I was doing a ton of education. I don't usually do things halfway, and I had completely thrown myself into learning. I am in medicine myself, so, I had some knowledge from going through medical school of all the things that could go wrong. And then I felt like I was just bolstering that by doing extra research on all the things that could go wrong. And I was, happy, but cautiously optimistic about how things were going to go. And Kevin, my husband, was really in a lot of the same boat. And we were frequently talking about how it almost seemed too good to be true and obsessively checking miscarriage calculators and saying, okay, today our chance of miscarriage is down by, 0.2%. Excellent. Let's celebrate. It was a little bit nuts.
Is Kevin in medicine?
He's not, but he's an engineer. So, he's wired,
Yeah, he's a different kind of abnormal from our abnormal.
Exactly.
And what kind of medicine are you in?
Yeah, I'm a psychiatrist, or specifically a forensic psychiatrist, which I would say is the last thing I ever thought I would do when I started medical school. I didn't even know this is a thing, but I have the best job in the world. So that's probably a different podcast, but yeah, very interesting job. So by Christmas, though, I'd say we had started really relaxing with the fact that this was going to happen. We started making plans for a nursery. A friend of mine had driven down for our wedding and had dropped off all of her baby supplies, started applying for daycares, and this really started sinking in that it was going to become a reality. Then we got to our anatomy scan on January 9th of this year, and I was nervous going into it. I remember posting on a what to expect message board saying that I was really worried, even though I knew the statistics. I knew more likely than not, much more likely than not, things are going to be just fine. And I worked hard to use some CBT techniques on myself to really convince myself that it was almost certainly going to be okay. And this was an opportunity to enjoy and to meet our baby and really see him. And by the appointment, I had mostly relaxed, but that really is when, kind of the other shoe fell off, so to speak. So the scan itself is one of the most disturbing memories, I have to say, I have of the entire experience looking back on that. Remember, Kevin was very excited and I was excited, but and I immediately knew there was something really not right. And, the ultrasonographer, was a little bit subdued, but what I now realize in retrospect, and very quickly in retrospect, was I just didn't have any amniotic fluid. So I was staring at this image on the screen. I was like, this is not what a baby looks like. But it wasn't. I was so flooded with anxiety then that I couldn't even put it together or even voice my concern. It's just like, this is a weird. What am I seeing? And she was pointing out the ultrasonographer. Here's its leg, and I'm measuring it. But I was like, something's really wrong. Right. Something's really wrong.
How far pregnant were you at the time? Was it 18 weeks, 20 weeks, 16?
Yeah, I was 18 weeks.
18 weeks. Okay.
So wanted to get in for as early as possible for that anatomy scan. And she did. So after she finished, she did say, I'm not seeing any, just about any amniotic fluid. See, there's just this little pocket over here. And she showed just this little pocket. And then I was like, oh yeah, of course. That's what's so utterly wrong with what I'm looking at here. And she just asked, if I had had any leaking. And I said, I hadn't. And she then let us know that she was going to go get the doctor and to take a look and to be back soon. And I remember her leaving the room and just being, just flooded with anxiety. And Kevin looking at me and said, so do we start Googling now? And I remember saying, I think we chuckled just a little bit. And I said, oh, that's probably not a good idea, but we have to, right? So of course we did the very quickest Google search in the world. And as I expected, of course, pulling way back into any medical knowledge I might have had of reasons why somebody might not have amniotic fluid at that point, I quickly confirmed that there's no reassuring reason not to have any amniotic fluid at this point. But, it was still confusing. And pretty quickly, fabulous maternal fetal medicine doctor named Dr. Rachel Wood came in. And she repeated some parts of the scan and then letting us know, what she was looking for, that she was mostly trying to see if his kidneys were anywhere else. And she ultimately sat down in front of us and said that she wasn't able to find them, that our baby boy didn't have any kidneys. And at that point, I crumpled because I knew immediately what that meant. And in her second breath, if she even did take a breath, she quickly said, this condition, I'm sorry to say, is incompatible with life. And at that point, I saw Kevin just kind of crumple at that point as well.
Right.
And I just want to pause here to acknowledge what an amazing clinical interaction this was. I mean, it was textbook. Dr. Wood was so compassionate. She shed some tears herself. She paused at that moment, let us know that she can provide as much or as little information on the situation and potential next steps as we'd like, really looking to us to figure out what we needed in the moment. And, I was thinking about this recently. I was listening to your podcast with Dr. Jorda about perinatal trauma.
Yeah.
And just thinking about how, in some ways I'm almost hesitant to share my story and a little bit sheepish about it because I had it, about as good as it could possibly be in some ways. With regards to this, Dr. Jorda, talks about in her podcast, the three potential things that could be done to lower the risk of it being a traumatic experience. And I feel like I had all of those things that were really in my favor. So one of those that you talked about was education. So both before and during the potentially traumatic experience. So I felt like I knew what could potentially happen before. I was very much educated about that, as well during, which I'll share, Dr. Wood meeting us where we were at, and then I'll share about some more providing education, the communication, so taking the time, meeting us where we were at, figuring out our style, and then also expectations. For better or for worse, I feel like for better in this case, I didn't have the highest expectations. I didn't think that this was all going to be great. I've talked to a lot of women in the last couple of months who've gone through similar things, and I had no idea that something like this could be discovered at this ultrasound. So a little bit of a sidebar there, but I do feel in some ways a little bit sheepish because, again, I do think, man, this was as good as it possibly could be in a really, really horrible situation. So Dr. Wood, then, after I let her know, and I do wonder, probably Kevin might have chosen something different. I don't know. I actually haven't explicitly asked him that, but, I did say, no, I want absolutely all the information. And she said, well, here are the next steps. So there is always the opportunity not to do anything. You can just continue the pregnancy. And, what I have to let you know is that we'll have a high rate or high risk of miscarriage, stillbirth, fetal demise versus preterm birth. If you do make it closer to term, you're at a high risk for a C-section, and the baby's likely to either be born deceased or would die shortly after birth. And to say, I think that's what she said. I'm sure I'm getting her words exactly right. So if she ever listens to this, I'm sure this is not word for word what she said, but that was kind of the general idea. That was clearly an option. Or, there was the option to end the pregnancy. And she let us know right then that could be done either surgically or by labor and delivery. And I remember very quickly saying that, first of all, I was really grateful that there was an exception to North Carolina's current 12-week ban on abortion. So there is an exception for if you have a diagnosis of a life-limiting fetal anomaly, you are then able to get an abortion up until 24 weeks.
Right.
And I remember one of the first things out of my mouth was, I am so grateful that this is such a black and white diagnosis.
Right.
The fact that this was clearly a lethal abnormality made it so much easier.
Right. Right. In many ways.
Gosh.
Legally, practically, emotionally, obviously. Well, maybe not emotionally, but at least sort of, I don't know, whatever grappling goes on internally. Just for our listeners, just to explain the reason that diagnosis is lethal. If the baby has no kidneys, the first problem that you would think is, okay, people need kidneys to survive. Well, you don't really need kidneys to survive in utero. After birth, you do, but someone would say, well, can't you do dialysis or a transplant? So yes, that part of the diagnosis can potentially be treated. But the issue is if you are a fetus with no amniotic fluid throughout pregnancy, the lungs don't develop. And so even if you could somehow fix the kidney issue, which is itself not really a great thing to do, it's not a great success rate, but even if you could, the baby doesn't have any lung function at birth. And so that's the reason it's essentially they don't survive after birth, and it's considered a lethal diagnosis. So that's just for our listeners to understand why that particular, because we have babies born with one kidney all the time and they're perfectly fine. And if there's situations where there's sort of low fluid for different reasons, but there's enough fluid, it's not quite as bad. But this is a classic, unfortunate lethal diagnosis. But yes, it makes it much more straightforward, at least in terms of counseling and decision making for a lot of people, because they don't have that ambiguity of, well, your baby might be this or might be that, in which case you're like, well, how the hell do I process that?
Oh, I know the stories I hear about women who, this mysterious brain abnormality. It's like, well, they could have mild to moderate learning disabilities, or be unable to feed themselves or walk. Or it's like, well, what the heck?
But it's interesting because it's not even mysterious ones. That's there's two issues with ambiguity and diagnoses, right? Well, there's three issues. One issue is sometimes people just either get bad information or don't understand the information told to them, where there is knowledge but they don't have it. That's one issue. The second issue is there are definitely diagnoses where we're not sure what's going on, sort of what we see, what it means, this or that. But interestingly, there's a lot of diagnoses where we know exactly what it is, like to the genetic, everything, to the point mutation, but there just happens to be a wide range of outcomes where like we know exactly what the condition is, the disease is, the malformation is, but we say, X% of these babies are fine and X% of these babies are mostly fine and X% of these babies are not well and X% of these babies are horribly not well. And like, that is just, these are so gruesome to receive across the board, but for different reasons. But, like you said, at least if you could say that in your story, it wasn't one of those situations. Like, we know what this is. This is uniformly lethal.
Yes.
This is terrible.
Yes. Yeah. And I do feel like that was in some way, silver lining is not the right word, but absolutely. It was one of the first things out of my mouth. I am so grateful.
Yeah.
It's crystal clear.
Did you have, before going into them, I'm just curious if you're comfortable answering this, going into this, did you have feelings about abortion beforehand? Just saying like, and were they sort of confirmed? Were they challenged? I'm just trying to get a sense. If you don't want to answer that, that's okay, obviously. But like, where were you a year ago if someone would talk about abortion with you?
Yeah, absolutely. So I've always been pretty solidly pro-choice.
Mm-hmm.
And I think, I've thought, and I believe now, it's just funny, it's a little hard to even remember, but I'm pretty sure Kevin and I even had some conversations about what this would mean. And we wouldn't want to bring an incredibly ill child into the world, where I think we felt like, we were doing these prenatal genetic tests for a potential reason. Not that we had sorted out, of course, every possible scenario, because you can't do that. But interestingly, if anything, in that way, I think going through this experience has made me feel like even more of an advocate for women's choice, because, oh my goodness, this is a different scenario than I think most people think of when they think about the run-of-the-mill abortions. Being said, it is interesting going through this. I think before, hearing some stories about some of those gray diagnoses or gray prognoses, I think I always thought it would have erred on the side of probably erring on the side of terminating out of safety, or erring on the side. But actually going through it, the more it was so hard. I'm just recognizing, I think, I'm not sure this is all coming out right, but I think what I'm just recognizing is how emotionally difficult it is to make that decision and do that, even if you think it's the right thing to do for your baby. I'm more on the fence about what I would do in the future if things weren't so black and white, because it was so hard, if that makes sense.
No, I think it makes complete sense. And I think that it sort of speaks to a number of things. Number one, obviously, that no matter, with obviously rare exceptions, it's very emotionally difficult for everyone to go through this in any direction. And I think the other thing is sort of not as an insulting way, but how the sort of naivete of most people about what's actually happening and what decisions are actually being made and what people do or don't have to go through. And, they think it's this, but again, and that's, why would anyone really understand that unless they have to go through it themselves, or they're, I haven't had to go through it myself, obviously, but I'm in that world. And so I have a better understanding, I would think, than, the person on the bus, about what abortion means and what the decisions that are being made and sort of what are the possible scenarios that this would come up. But I think that it, like as a sort of an overarching lesson with all of the aggressive conversations about abortion is like a little humility that, that most people who are very, very passionate in either direction about abortion don't really understand the topic as well as they could, is what I would say.
It is so true. And, one of the refrains that I hear so often from women who have been through similar things is, they talk about taking on the pain so that their baby doesn't have to. And which is so different from, I think so many people might look at the situation and say, oh, well, you're just taking the easy way out because you don't want this burden of raising a sick baby or this and that, or you don't want to, it's, these are not selfish decisions. And I think, in this scenario for me, it was like crystal clear that, I've got my baby, or I do feel like it's my baby. Absolutely. And yet he's only 18 weeks along. And the longer I wait, the more likely he is to probably start experiencing some kind of discomfort. And I know there's some controversy around exactly when fetuses can start feeling pain, but most physicians, medical organizations argue, please let me know if I'm wrong, about 24 or so weeks, maybe 25 weeks. And for me, that was just such a no-brainer. If I were to continue the pregnancy, he would have been so squished. He was becoming so deformed without any amniotic fluid, definitely not comfortable, definitely in pain. And then if he did happen to make it to term and be born alive, he wouldn't survive for long at all. And I didn't want him to be born suffocating, gasping for air. Or, it's just, to me, it was just clearly the humane thing to do. So, and this isn't the right thing to do for everyone, but to take the choice away from mothers and parents to do what they think is the right thing in the best interest of their kids is just cruel. And, it's a little bit bizarre to me thinking that, we might look at parents who are facing a child or an infant who's been born with some kind of a terminal illness and making the decision to stop pursuing aggressive chemotherapy or whatever it is, to let them be in peace. They can be looked on as heroes and really brave to make a tough decision in the best interest of their kids. But when it comes to an abortion, to do different. I don't really get into a medical ethics discussion here, but there's a lot of parallel in what you're doing. You're trying to keep your child from suffering when you know that it's not ultimately going to result in a good outcome. It's just the guilt and shame and stigma around it. It's bizarre.
Yeah,
because it's
it is, and it's unfortunate. Did you at the time? Did you feel the need to, I don't know, talk to others? Or, obviously you sort of knew what you wanted to do pretty quickly, it sounds like, but did you have to feel like, oh, I'm going to run this by someone, I want to talk to a friend, a family member, somebody, or did you just sort of like this, I know this is the right decision to what we're doing? Because, people obviously to very different degrees grapple with what they're going to do.
Yeah, no. And this was a little bit of a difference between my husband and I and how we make decisions, which is something we know about ourselves. We make decisions very differently and we process things differently. I usually make very quick decisions and I like to pull off painful things like a Band-Aid. So it was really in that about, 30 to 60 seconds. After Dr. Wood kind of dropped the bomb and said, these are your options. I said, oh no, absolutely. At more or less as soon as possible, I would want to do a surgical termination. I kind of had thought about it before, and it was crystal clear to me. I know, she did, interject several times and say, please take all the time you want. If you want a second opinion, that is totally valid. It was amazing if you want us to just do a second ultrasound just to confirm things. I can tell you, it's not going to change anything, but that's really valid. And that is something that my husband wanted just kind of for peace of mind. So we were able to work with this. The clinic was just amazing, just being able to work around our schedules and trying to make this happen. So we were able to find a way to get in for a second ultrasound with a different doctor, just double checking to put his mind at ease while also not pushing back the procedure anymore, because I knew that limbo period is going to be so hard. So I didn't want to, I didn't want to delay it.
Yeah. What was it like going through the procedure?
Yeah. So I would say the hardest part of the whole thing was the waiting. One of the other, I'm really grateful that I didn't have to travel out of state. Many women are traveling out of state these days for this. I was able to do this in North Carolina, and I'm grateful, even if I did have to travel, I had the means to do so.
Right.
But, one of the things in North Carolina is that there has to be a 72-hour waiting period after providing in-person informed consent. And, oh my gosh, going through that is, how about some laughter with the tears with Dr. Wood reading all the statements. And I understand that adoption is an option. And I understand that the father's would be responsible for paying, child support. It's like, this is utterly insane. And she's like, I'm so sorry. Just insanity when politicians get in the exam room. It's just, anyway.
Yeah.
Because of that waiting period and with OR schedules, there wasn't that waiting period. We would have been able to get in and get this done in a couple of days, which is really what I had been hoping to do, because it's just so painful walking around and getting increasingly bonded to this baby and just feeling like I'm pregnant and starting to look pregnant. And yet, oh my goodness, it was just horrible. So we ended up having to wait, 10 days. It could have been worse. The procedure itself, very difficult to show up in the hospital that morning, knowing I was pregnant, but also knowing that I was about to not be anymore. One of the great things is that, in that week or so, I had gotten connected with a lot of women in support groups, in local communities, as well as around the world, really, which I knew from going through other hard things in life is like the key when you're going through something really hard. Talk to people who've done it before. And it was really helpful. I was texting with some of them, waiting for in pre-op kind of what I was going through. And my husband was there and absolutely lovely, just my biggest support. Some things that were also hard is, and I don't blame anybody. I remember the pre-op nurse not acknowledging at all what was going on. And I don't blame her, but geez, it was just otherworldly. I'm just another surgical patient.
Yeah. I mean, for all, it's like you're getting your gallbladder out.
I know. And again, it's like, oh, my baby's dying this morning. There is
some compartmentalizing that is sometimes needed to be done for people to carry about their day.
Yeah.
But it is, like you said before, bizarre.
Very bizarre. Very bizarre. But I would say being wheeled into the, out of the pre-op room away from my husband was probably the hardest moment of the day for, all of us. I just remember, just the tears like really started coming at that moment and, saying goodbye to him, knowing that it was like our last moments as a family of three in a way.
Yeah.
And I was going to wake up empty.
Yeah. Was it your doctor who you knew or someone who you got referred to?
It was someone that we got referred to do the procedure itself.
Okay.
But he was fantastic too. We had just met him that morning, but Dr. Jonas Schwartz, who this is kind of the kind of stuff he does. And he also came in with the right tone, answered questions, really left the exam room feeling very heard and cared for by him. So really grateful for that. And one thing, in retrospect that one of the options was to deliver, go through labor and delivery. That for me at the time was completely under the question. It seemed way too painful to go through that. I mean, part of it was, prior fear about labor and childbirth in general, and that having that first experience ending up with a dead baby seemed really traumatic, but also just it seemed too personalized. Right.
When you say painful, you mean emotionally.
Emotionally, well, and physically. The whole thing just sounded like that's the worst of both scenarios.
Right.
In retrospect, if I could make the decision today, I would do that. I wish, I wish, if I had a chance to hold my baby, I wish I had that option, but I don't regret it because I couldn't have then. I couldn't have. It would have been too painful.
Yeah. Yeah.
But gosh, to have met him would have been amazing. So.
Yeah, that's part of that decision, which again, you're not equipped to make that decision, before you go through it. Yeah, I mean, you just can't be, obviously. And so you can only look in hindsight and say, oh, if I could do it again, I would do it the other way or whatever that is. Again, either someone like you chose to do the surgical procedure, so basically go to sleep, you wake up, it's done, versus the induction, which is a little bit longer, but obviously you get a chance, you're not put to sleep and you get a chance to hold your baby, or vice versa, someone who chooses the induction, or because there isn't someone with the skills necessary to do the procedure, right? They're not readily available. Certainly in other states, they're not readily available. And so they do that and they're like, this was too emotionally painful. I wish I could have just gone to sleep and wake up. And you don't know that. How would you possibly predict that about yourself? You take your best guess, but it's almost impossible to guess right other than flipping a coin.
Absolutely. Absolutely. Yeah. Yeah.
Wow. And so, obviously I assume the procedure went well medically. What was it like when you're done and you guys went home?
Yeah. So the procedure physically was very easy. I have to say, I really just about no pain, minimal bleeding. Of course, though, it was a very sad time afterwards, especially, it's sad and I could totally feel my hormones like plummeting. And it is bizarre, suddenly postpartum, but without a baby. And one thing to mention for some of your listeners who might not know is one of the things that can absolutely happen after a late pregnancy loss like this is, your milk can come in.
Yeah, I was going to just ask you, did your milk come in?
No, I had asked on the day before procedure when they were starting the cervical dilation, I had specifically asked for a dose of Ergoline to stop that. So that's, a dose of medication that can stop you from lactating afterwards, because I knew that would be really emotionally challenging. So that did not happen.
Okay.
And I was grateful for that. And, so that was a Friday that we had the procedure, and it was an incredibly sad weekend. I made probably an insane decision to try to go back to work the Monday after that. And I did end up having to leave that day, midday. I was just, teary, and I was not in the headspace to do that. And I still probably made the similarly nutty decision to go back to work the day after that. And I did work, which I have to say, from at least the people I've talked about, is very unusual. I think part of it was, actually most of it, I think, was coping strategy. I like work. It's where I feel like I can be a little bit in control of things, and it was a distraction. And I thought about taking time off, and my work was very supportive of me taking time off if I needed to. But I was just like, what am I going to do? I'm just going to sit on the couch and be sad. That seems scary to me, which probably suggests I should probably get back into therapy to process that. Although I will say I was in therapy at that time. I was in therapy for a little while, but like, why is that so hard to just sit with emotions? But it was, it was a challenging time. And there are all these other decisions you have to make, and fallout, right? Do you want a funeral? Do you want to be cremated? Do you want footprints? All of these things that you're just not planning, and you're just planning a nursery weeks before. But, yeah.
Wow. What I would like to do is I want to pick it up next week and talk about sort of the aftermath of this, personally, in your family, amongst your friends, and also the future for you, like where you see yourself headed. And then importantly, I want to talk about this topic and why your story is important and why you think it's important and what people, what you hope they take away from this story. So I want to do that next week and give it its own time so we don't rush it and do it in a separate podcast.
Sounds great.
So thank you so much. And we are going to pick it up next week with part 2 of your story. Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.